What's up, everybody? Dr. Loveless with Dr. Lonnie Bagwell. Thanks so much for joining today. We're going to talk to you guys about neck pain, and really the idea of us doing this weekly on Tuesdays is really to shift your thinking, to get you thinking differently for different topics. The title of this show is really True Health, and to teach you guys what health truly is. The body heals from the above down, inside out. It doesn't need help healing. That it really just needs no interference. And so we're really diving into things like back pain, neck pain, headaches, carpal tunnel syndrome, things like that are just pain syndromes. A lot of times we talk about big stuff or organic things like digestive issues, hormone issues, and a lot of times we miss what we think of as the simple stuff, or at least for us many times to help people with is simple, like neck pain and shoulder pain, even though those are some of the main reasons people go to a doctor. So we decided we're going to really hone in on those things with this show. So Dr. Lonnie, he's up in Huntersville with True Health Center in Huntersville, just North Charlotte, and I'm in Queen City Health Center in South Park and Matthews in Charlotte. And we really just wanted to dive into neck pain today. I think we have a shorter show because Dr. Lonnie's too busy for you guys. So just kidding. All right, so let's dive into this. So Dr. Lonnie, you said you had some stats you wanted to share with neck pain. So let's go for that.
Well, it's just, generally speaking with neck pain, it's one of the most common reasons why it's certainly the number one reason why people go to chiropractors when coupled with headaches, right? We hear headache, neck pain, and then we get into back pain, which we've already talked about on different episodes. And I guess the overarching theme for me here is that why is that? Well, sometimes we can show a bunch of statistics, but at the end of the day, I think that the people have spoken. That people wouldn't keep doing something just because someone told them to do it if it wasn't effective. So as much as we have tons of statistics and really cool, I actually read some studies before hopping on the call today that I had not read before that I thought were pretty awesome that I'll share. But generally speaking, the people have spoken. It's the most effective form of reducing the symptoms. Okay, but then there's other additional benefits that I'm sure we'll dive into. Versus the drawbacks of a traditional medical approach. But one of the really cool, there's a lot of stuff that just says, go to the chiropractor if you want to improve beyond. I think I saw 3 studies just real fast. If you want to be, better than physical therapy, better than going to your general practitioner, overall reduction in symptomatology versus medications, it just outperforms every single category. But some of the statistics were pretty staggering. And a lot of these studies were literally thousands of people over 52 weeks. Right. So it wasn't like, a chiropractor in his office in the middle of nowhere looked at 4 people and, got them neck pain free for 7 days and then published the study. Right. This is literally 200, 700, 900, 1,100 people over anywhere from 12 to 52 weeks. But faster recovery is the number one thing, which I already kind of talked about. But the other cool thing is that overall, when you really consider the nickel and diming that other approaches really do to the patient, it's at 1/3 the cost. Mm-hmm. So it's not only is it faster recovery, but it's sustained for a longer period of time, as much as 75% longer period of time, according to the research I was reading this morning, at 1/3 the cost overall. And so I know a lot of people think, well, once I start going to the chiropractor, I have to keep going, and that's going to rack up the bill. And we're in this industry, like we hear all that stuff all the time. Now we do corrective care and restorative care, so that obviously changes that whole conversation for us with patients. But at the end of the day, I just wanted to, I guess, be able to share with people that all those fears of is it going to work? Nope, the people have spoken. Will it last longer than anything else? And does it cost a bunch? Nope, 1/3 of what the other typical modalities actually cost. And then we can get into the discussion around what are the side effects, right? There may not be side effects to physical therapy, so I'll give them that. But when we get into the traditional general practitioner treatment for neck pain, now we're really getting into serious side effects of medications and opioids, which, by the way, if you go to the chiropractor first, but for neck pain before going to a general practitioner, you have over a 60% less likelihood of taking opioids. And the number of surgeries that actually come, if you go to the chiropractor first for neck pain, the number of surgeries goes from, I think, 47% likelihood of a surgery if you went to the medical doctor first, all the way down to 1.5%. 1.5% likelihood of surgery if you go to the chiropractor first. So the side effects might be, reason enough. I know if I'm making a decision, I certainly don't want to have a 50-50 shot of needing some kind of a significant intervention that cost tens of thousands of dollars and, ultimately no good outcome. So I got kind of fired up before we got on the thing today.
I can tell. I can tell.
Awesome.
I said there's a study. One of my favorite studies I go back to is just they did. They took all the different kind of therapies out there, from physical therapy to chiropractic, E-stim, ultrasound, and nothing yet has beaten the placebo except for chiropractic for spine pain. I mean, that's just spine pain, but nothing has beaten the placebo yet. And that's why, physical therapy is trying to, add manipulation, things like that into their studies, because it's just that effective to put motion into the joint, block the stress response. Motion is the key to life. I talk about that all the time, is that 90% of the stimulation to your brain comes from the movement of your spine. So let's just take a step back. I want to talk to you guys about what neck pain actually is. So when you have a lot of people, I put in the title that, or what I had posted earlier, that a lot of people say when they come in, like, hey, it's just stress. I carry all my stress right here. We always say that. And I always like to say, you feel your stress in the most problematic areas. So when you're stressed, the most problematic area is what you're going to start to feel. And the reason you feel that is most of the time it's because you have what we call subluxation, or lack of movement in your spine. Your spine's not moving. And when it does that, it creates a stress response. You get inflammation in that area, and then you start to feel pain if it's there long enough. What a lot of people don't realize is that pain part is really a small portion of your nervous system. Only about 9% of the nerves in your body are for pain. And so when you start actually feeling the neck pain, what that tells us is the problem is hitting the nerves causing pain. And most of the time, it's usually a problem that's been there for a while, unless you have a specific injury that you can relate that back to. And I'll give you an example for myself. Right before I got here, I was like, hey, Dr. Lonnie, my neck is actually killing me. This is kind of funny. We're going to talk about neck pain. I can't tell you when I've had neck pain before. I just don't ever remember ever having neck pain. But about 2 weeks ago, and I shot a video about this actually, about 2 weeks ago, I was working out and I had about an 80-pound sandbag on my shoulders doing lunges, and I went to go shift the sandbag. It popped up and landed on my head right here, pushed my head down, and instead of just letting it fall, I held it up with my neck and pushed it back, which was a mistake. I could just feel the tension build up there. And sure enough, next day, my neck was killing me. I went through adjustments. I did neck traction, did some muscle work as well. And within about three days, the pain was gone. I was feeling good again. I thought everything was better. And, just so happens Saturday night, 4 a.m., I woke up, felt great. Eleanor's in the other room. She's 3 years old and she's yelling my name, or daddy, I guess, yelling for me to come in. I went to her room, fell back to sleep with her, woke up at 6. And my neck was killing me. I was like, oh man, it's just because I probably irritated a disc in my lower neck. And so now I had the pain going through here again. I can barely turn my head all the way. And so I feel what it feels like, and it's just miserable. But I feel for the people that have no idea what to do about that, and they just go to an ibuprofen. Luckily, I know, hey, look, it's inflamed. I gotta get adjusted. I gotta get my spine moving again. I gotta give it rest. And those things, and just let it do its thing, and take anti-inflammatory supplements and things like that to help. But it's just going to take some time to heal. It's just how it is. It's an acute injury. I want to talk to you people. I want to talk to you guys about actual chronic injury, chronic neck pain, because I think that's the bigger issue. When you know where it came from, we can let it rest. We can work on getting it moving and get rid of pain. But when you're someone that's been, you're at a computer most of your day. If you work at a computer more than 4 hours a day, you're susceptible to what I'm talking about right now, that your head is like this, right? All the way to my head right now is going right here. And if that stays that way long enough, it's going to create chronic irritation and stress into your lower neck and upper back, and you're eventually going to start to feel pain from it. And that's just the pain you're feeling. Those nerves in the upper part of your back also go to your heart, they go to your lungs. It's a huge part of your other overall health in general. And they've actually shown that when you get that forward head posture, you start to decrease heart health, you start to decrease breathing, the ability to breathe. And so if you're someone that's sitting at a computer all the time, you're very susceptible to this. If you're having neck pain, that's probably the cause of it. So sitting at a computer is one of the main things I'll see. Dr. Lonnie, what are some other areas, because I just feel like I'm talking now. What are some, you still there with us?
I'm here.
Yeah. What are some other areas, other things you see causing neck pain?
Well, aside from 80-pound sandbag, is that what it was?
Yeah.
I'm
talking about chronic neck pain, not
I was just wondering, let me just say this real quick. Let me say
not dumb. I wish I was 20 still neck pain.
You're my excuse why I can't work out like that, because one of us has to stay healthy to be able to help the other person. Yeah. So in case anybody's wondering why I'm not out there doing those kind of workouts.
Last time my back hurt is because of wakeboarding. So
that's right. Also, that's why I don't wakeboard. Like, I can't do these things because I need to be able to take care of you. But yeah, one thing so a couple of things popped in my mind. First of all, and I think we need to lend some perspective for people kind of to build on some of the stuff you just said. First of all, repetitive stress trauma. I've talked about that before with when we talk about shoulder injuries and elbow and all these different things. Repetitive, we don't think about it as much with our neck, but like when I saw you sitting there, every time you sit in front of one of those computers, right? Every time I'm at a standing desk right now, but every time you're sitting at a computer, your head's going forward. That's a repetitive stress trauma. And they're the scariest ones because those are the ones that don't feel like anything until something's seriously wrong. Right. So oftentimes it's not, and people say, well, if it's just my head going forward, then, shouldn't I just be able to work the muscles for it to come back? But those muscles are attached to the structure underneath. Right. So, so you can do massage, you can do physical therapy, and we endorse those things or actually offer those things here in our office. But at the end of the day, structure dictates function. So when people talk about it being expensive to manage their health, right, and in the alternative ways that aren't covered by insurance and all that kind of stuff, whatever, yeah, it is, because you're just basically leasing pain relief with a massage, or you're leasing pain relief with some stretches, right? Until you go in and actually affect the structure underneath that soft tissue is attached to, you're not going to get any kind of permanent change. And and when you put your head forward, it reminded me of this, is that everybody's head weighs an average of 8 to 10 pounds, right? That's the general, kind of poundage that we talk about. But as your head goes forward, it doesn't just go from 8 to 10 to 12 to 14 to 16 to 18. It doesn't work like that. It goes from 8 to 10 to 20 to 35 to 60 pounds of pressure. And I think that's super important right now, because you just got done talking about an injury with an 80-pound bag on your shoulders, right? Well, people don't realize that they sit in front of their computer all day long. That 8 to 10 pound head is putting 40 or 50 pounds potentially worth of pressure, functional pressure, into those muscles. So no one ever carries their stress anywhere, right? But if you did, theoretically, you carry your stress through your whole body, but where you become symptomatic is where there's a breakdown in the biomechanics, right? Where the soft tissue's failed, where the structure underneath is lost its integrity, just like the foundation of a house. And so all that said, sleeping positions, like you just mentioned, is super critical. If you have 2 inches of forward head posture, you are way more susceptible to sleeping wrong, where there are people who sleep like a pretzel tied up with their head 45 degrees to the side, yet they don't have neck pain. And I think that's another real important, always trying to reset people's framework and their mindset around, how they're dealing with their symptoms and whatnot. You have to understand that there are people who sit in front of a computer 65 hours a week and don't have neck pain. They come in for low back pain, but then their partner next to them, right in the cubicle over, will come in for neck pain and no low back pain. And so it's always better. It's just, as always, it's ask better questions, get better answers in the form of, say, an x-ray. In this case, right, you would know, nope, this person has a beautiful curve in their neck, so this must be a soft tissue injury, versus that person that comes in and says, nope, I don't feel any tension in my muscles so much as I have pain right here. And then all of a sudden they have a reverse curve and degeneration in their joints because of how long they've been sitting down. So anyway, so just a little bit more perspective there.
Yeah, and so if it's a chronic thing where you're actually having this soreness and it comes about every time you're stressed, that's not a muscle issue. And a lot of times people say, oh, it's just the muscles. No, your muscles are responding to the structure and to the irritation to the nervous system. So I want to show you guys this so you can actually see. I like to have my trusty poster. So this is your neck, and you can see these yellow things coming out of it. I know how to be feeling funny. I see my head over here, I guess. So the neck coming out, those nerves, all this is your brachial plexus. You see all these nerves here. If those bones right there are out of alignment, if they don't move, if you have any disc irritation or herniation, if you have any degenerative changes like arthritis or bone spurring, and it starts to affect those nerves, that's what you're feeling, right? Your muscle tightness and tension is your body actually protecting you. You have a core of muscles right there that will bundle up like this to protect you from making it worse. So it's not a muscle issue. So if I go in and release your muscle, but I never actually fix the spine, believe it or not, I'm actually making your problem worse. I want to go in and get your spine moving, release irritation to the nervous system, now start to release the muscular system, and start to retrain the muscular system.
So important. Yeah, the body's not making a mistake, right?
Let me say this first though. Watch. So now we want to get this curve back in your neck. And the reason that's so important is all this, that I just showed you the neuromuscular system, but I want to show you the nervous system that actually controls organs, your sympathetic, your parasympathetic nervous system. Look, that's to your heart. That's right in the lower part of your neck. That's to your, right there, to your lungs, right here. So that's right to your lungs. So this controls everything. And that people don't realize how crucial that is. If you have neck pain, you're setting yourself up for heart problems. If you have neck pain and you start to build degeneration, lung problems, breathing issues. I mean, it can be headaches, can lead to sympathetic, your parasympathetic response. This blue vagus nerve, that goes to every organ, tissue, cell in your body and tells your body to relax, digest food, sleep. So the reason with chiropractic, just take a side note off of neck pain, the reason when we start adjusting spines and the neck pain goes away, but then on their re-exam, their first re-exam, neck pain's decreased or gone, but their digestive system's working better, they're actually sleeping better at night, maybe even menstrual cycle issues have changed. It's because of that parasympathetic nervous system we're stimulating and relaxing the body, and the body's heal itself throughout. So in neck pain, you're feeling it, but your body is actually experiencing much more than just pain if it's there. So pain is simply like your radar system. Your fire alarm's going off, and we're simply just saying, call the fire department, take a pill and spray it down, instead of saying, hey, fire alarm's going off. Let's figure out who's causing the fire. Let's stop the person or the thing causing the fire, get to the stressors, restore health to your body, and then your body now you have a long-term result. And do you go to a chiropractor for the rest of your life? I do, but do you have to? No, you don't have to for pain. I choose to, or Dr. Lonnie chooses to, or my wife, or a lot of our patients who have been coming for years choose to go on a weekly basis or a bi-weekly basis or a monthly basis to get adjusted, because they see the value in helping your body. You're making sure your spine is moving properly, it's in alignment, it's not degenerating, and they see the value of how it affects stress in your life. So that's the big picture of it. But if you're having neck pain, you're at the very beginning of that picture. I mean, there's some therapeutic things that need to be corrected. We need to not only get your spine moving, get irritation off the nervous system, we need to work on the structure and the muscular system, and then you can dive into nutrition and all that other fun stuff that we get to do in our offices as well. So that's my big picture with it. I know Dr. Lonnie has to jump off soon, so we're gonna get things moving for you. You still there?
I'm here.
Okay. We're gonna get things moving. But that's the big picture, guys. If you want to figure out what's causing your neck pain, first step, we go through consult, we go through exams, right? Evaluations, see what's moving, what's not moving in your spine, see where the irritation is, and look at your posture. The second step is we take x-rays. Many times we'll do motion x-rays to see what's moving and not moving. Many times we'll just take still x-rays to see if there's any degenerative changes, loss of curvature, loss of biomechanics. And then from there, now we can create an actual plan that's going to last, right? So Dr. Lonnie had to jump off, but we can actually create a plan that's going to last for you. And that might be a 1 month plan, that might be 2 months, that might be 3 months, based on the phase of degeneration that you're in. Cool. And so guys, hey, if you're listening right now and you want help with your neck, you're tired of having neck pain, you're tired of having shoulder pain, go to queencityhealthcenter.com or go to truehealthcharlotte.com, and either one of us would love to help you. Hey, if you don't live in the Charlotte area and you want help with your neck, that's a chiropractic thing. It's not something we do virtual like we can do a lot of the nutrition stuff that we do and everything else. So simply message me. I'll be happy to connect you with a doctor in your area. I've connected people with people all over the country in terms of good chiropractors that can help you with neck pain. But it is a big deal. It's not just something you can live with, or you can live with. It's not something I would suggest ever living with. One, because it decreases the quality of your life, and two, it actually has a huge negative impact on your overall health as well. Cool. All right. Hey, that was a quick little video on neck pain. I hope you guys got a lot out of that. And also, hey, like this, love it, share it. People really need to understand that pain meds aren't the answer. Ibuprofen's not the answer, right? Just taking medications is going to get us into a very negative place, already has in our country, really. So we need to find the root cause of the problem. Share this with someone you know that has neck pain or that has shoulder pain. We would love to help them. All right. Hey, you guys have an awesome day, and we will talk to you next time.